Do you have a torn meniscus? We're going to go through the top 5 signs that you may have a torn meniscus. Welcome to Talking with Docs. I'm Dr. Brad Mooney.
And I'm Dr. Paul Zalzal.
Right out of the gate, if you have a torn meniscus, if you've had one, if you have any of these symptoms, leave a comment. Share with someone how you found out that you had a torn meniscus.
What's a meniscus?
So it's that little shock absorber that lives between your thigh bone and your shin bone. It's a little piece of cartilage. There's one on the inside, one on the outside, and it can tear for a bunch of different reasons.
All right, put those fries in a bag for a minute here. The question is, what's the role of the meniscus in your knee?
Wait a second. What is that? What is that phrase?
I don't know. My kids taught it to me.
Okay, put those fries in a bag.
Nobody ordered a Yap Fest.
Okay.
All right, so you've got this meniscus in your knee. It's a shock absorber. It's supposed to stop that round femoral condyle from banging into the flat tibial plateau by distributing the forces.
Right, and protects that kind of lining cartilage that if it wears away, that's what leads to arthritis. So this helps prevent your arthritis.
Okay, I don't want to have a tear. How do I know if I have a tear of my meniscus?
So for me, we're going to go through the top 5. So for me, the number one is pain. So often sharp stabbing pain more than dull aching pain. Typically on the inside of your knee. Sometimes it curves to the back, a little bit in the front, but usually more in the middle and the back. So sharp stabbing pain in the proper location along the joint line.
Okay, that's a good one. For me, one of the most important things is you have a mechanism of injury that could have caused a meniscal tear.
So trauma.
Trauma. You didn't just wake up one day thinking, oh, my knee's hurting a little bit, and then it gets worse and worse and worse.
Okay.
No, you jumped up for a layup, came down, twisted, some sort of trauma while you're playing basketball or soccer or running, stepped off a curb. Something happened, and then you had pain.
Okay, so that's number 2, some type of trauma. So I'd say number 3 for me is no trauma. So you're a little bit older maybe, and you woke up. Like this is what happens as you get older. You're like, I went to bed, I was fine, I woke up, and now I got a sore knee. So no trauma, and you may be suffering from what's called a degenerative tear of your meniscus. So an age-related tear. And what's interesting about the meniscus is if you look at it from the inside to the outside, it's almost paper thin and then becomes very thick. And that paper thin inner margin is certainly prone to what's called degenerative tearing. So you may wake up with essentially no trauma and have similar symptoms. So for me, it's no trauma.
Okay.
That's number 3.
All right. For me, it's more trauma. No, I'm just kidding. For me, it's a pain in the location of the meniscus when I do a physical examination.
Okay.
I look for tenderness right at the site of the meniscus. If that's there, that's like telling me, yeah, maybe there's a meniscal tear there.
Okay. And then number 5 for me is a specific activity that causes. So when people tell me that they have trouble with kneeling, squatting, and sometimes even going up and down the stairs, and this aggravates that pain, reproduces that sharp pain, that for me is going to tell me that there's a higher chance that they may have a torn meniscus.
Okay, so yeah, look, you have a torn. How are you going to prove it now? How are you going to figure that out for sure?
So I'd say there's only 2 ways to prove it.
Okay.
One is an MRI has a high chance of determining whether or not you have a torn meniscus.
MRI, good for the soft tissues. That's a good way to see if you have a torn meniscus.
And lots of people come to our office and say, I need an MRI. And we're like, no, you don't need an MRI. Yeah. For this case, you actually may need an MRI. I'd say the only other way is with arthroscopy, is actually putting a camera inside of your knee and looking at it. We rarely would ever use arthroscopy now as a diagnostic tool. Not never, but almost never. More typically, we would have the MRI first, diagnose the tear, and then proceed on to arthroscopy if needed.
And there is a little bit of a push for these things called nanoscopes, where your doctor might do it in the office in certain settings to look for something like that. It hasn't really gained popularity in our neck of the woods yet, but you may live in a part of the world where, yeah, look, my doctor did a nanoscope in his office to look for it.
There you go.
That's another topic altogether.
That's a whole nother topic.
Okay, so MRI or looking at it through the scope tells you that you have the meniscus. And now, what are you going to do about it if you have a meniscus?
So the unfortunate thing about a torn meniscus, unless you're very, very young, is that it does not have the ability to heal on its own because of the nature of the blood supply to this tissue. So it's really going to primarily, for me, be determined by your symptoms, or along one other line that we talked about before or didn't talk about is that if you have a locked knee, we may be forced to do something. You can't fully bend or fully straighten your knee because that meniscus is displaced. So you can have a trial of non-operative treatment, which includes anti-inflammatories and ice and physiotherapy and maybe even a brace to see if you can function. And if that fails, or even an injection, if that fails, then we would have to consider arthroscopy if your symptoms are severe.
Okay, and one big important distinguishing factors that helps you decide on the treatment is what's the rest of your knee look like?
Right.
Is on one end of the scale, the rest of your knee is pristine and you just have this meniscal tear, then yeah, some form of arthroscopy to deal with the meniscal tear will be helpful. On the other end of the spectrum is you have severe arthritis, all the cartilage is gone, your bone is rubbing on your bone, and you have the meniscal tear. Dealing with that meniscal tear will do nothing good for you.
We wish you did not have an MRI.
Yeah, that is do we treat the arthritis?
Right.
And then many people live in between that spectrum, and that's where it gets a little bit tricky to decide what to do with that meniscus.
And this is something that you're going to have a discussion with your primary care provider or potentially an orthopedic surgeon.
And we've had this discussion with our patients thousands of
Literally
times because this is a very, very common entity. It's very commonly diagnosed.
Now you know all about the torn meniscus. If you like this video, please like and subscribe to our channel.
And remember, you are in charge of your own health.
We'll see you next time.